big news this week. It's all about health. A leaked document shows the Ministry of Health trying to take the power away from the elected health boards. Jackie Dean, what's going on?
Well, it was actually a report to the Director General of Health, commissioned that report, which is business as usual for governments. You're always putting reports up to Cabinet, and from what Jonathan Coleman has said, he says it's not top of his agenda. So
what is it? Less elected representative. This is the removal of democracy from local health boards.
There was a discussion around a different mix between elected and appointed members on district health boards.
So what's the ratio? The ratio in it's what's going to happen?
Reduce them to 9, have 6 of them appointed by the minister and 3 from the community, but unfortunately they can only be on for 6 months and they'd be rotated off and they'd come from a community advisory committee. So this actually was a paper that the Director General's gone out and consulted on, but my point is there is no way the minister didn't know about it unless he's incompetent, because a minister should know what goes out to be spoken about.
It for the people in New Zealand watching this across the country tonight. What's wrong with that? What's the big deal?
Well, I'll tell you what. People gave a very clear signal back in 1999. They wanted democracy back in decision-making in their health boards.
It's a long
it had been
time
taken
ago,
away. It doesn't matter whether it was a long time ago or not. They wanted democracy back into the district health boards. There has been no reason why suddenly we take it away without telling the public before the election that's what you're going to do. But actually... Well,
all right, Jackie.
But the minister has backed off it this week, so it may not happen.
Isn't it more important than that we focus on health outcomes? Isn't it more important that we have a look at the year-on-year increase in health?
Okay, let's talk about those health outcomes soon. Derek Paul, what does New Zealand First think about this? If you look around the region, if you look at their targeted, or where you're from, Palmerston North, what are you seeing in health in your part of the world?
Well, it's not working. Plain and simple,
it's not working.
Well, it's underfunded. It's underfunded. I mean, we've got the Mid-Central Health Board who owe their staff something phenomenal hours in holiday pay. I think it's about $6 million in holiday pay that they haven't been able to take because they're understaffed. They're underfunded. They're stretched as it is. We've got the Southern DHB who's got the commissioner in there. They've had to make cuts. It's just the way that the funding model is being presented to them, and including with the democratic votes on the board.
And you've been using shock tactics, haven't you, with your press statements calling the underfunding brutal. What do you mean by that?
Well,
how much underfunded?
About 1.7 billion since 2009.
Well, that's not true.
Well, in fact, we've finally got some independent work done on what is the underfunding in health. And we had it done by Infometrics, not by the Labor Party, a very well-known research organisation. They used Treasury figures, and Treasury's figures showed an underfunding over 4 out of the last 6 budgets for health, a shortfall of $1.7 billion.
Jackie talks about...
I'm sorry, but it's simply not true. The national government has invested as much in a percentage of GDP-wise into health as Labor always did. We have put an extra $400 million year on year into health, and now we have a total spend of nearly $16 billion going into health. So
why is it not working, Jackie? Why is it not working?
Okay, let's have
We've
a look
got
at
DHBs that are failing. We've got DHBs that are understaffed, and they're underfunded.
If you'll let me speak, let's have a look at the number of electives. They have gone down. Cancer waiting times have gone down. There's extra money going into things like palliative care and hospice care, bowel cancer screening programs. It's not true to say the health system is failing. It's just not true.
That does sound good, doesn't it? It might be underfunded by $500 million, but they talk about extra
$1.7 billion, in fact. No, it wasn't half a billion. 1.7 billion shortfall from 2009. That's a hell of a lot of money out of district health boards. But it also is what you measure, Wallace. If you're only going to measure some things and say, here's our ticks, this is doing all right, it's really important that you look across the health of the community.
And across the health, is it better for the future, for 21st century health in New Zealand, to have centres of excellence around the country? So services can't be duplicated. You might go to neurology in Christchurch, you might go to Dunedin, you might go to sort of orthopaedic specialists in Waikato, or diabetes in Waikato.
You're quite right, Wallace, but we already have some of that. For example, Starship is our centre of excellence for children, very high level needs for children. We have other places where our tertiary hospitals only do some things. We probably could have more of it, and we could probably use our smaller hospitals a lot better than we are now.
Do we have too many hospitals, Derek? Do we have too many sort of large hospitals? Do we need sort of smaller medical centres?
Yeah, well, it's like I was alluding to before, it's not how much we're spending, it's how we're spending it. And it's how the DHBs are set up. We've got far too many DHBs, we've got far too many administrators within the DHBs. So what would you see then? What would New Zealand first, what would you like to see personally? Oh, well, the Centre of Excellence is a good idea.
Right.
And like Annette said, we've got those, and if we can invest in the right way, then it's going to be a good thing.
Big news this week as well, the Trans-Pacific Partnership. How is that going to impact on the budget? Is it going to rise prices of drugs up? Jackie Dean.
Well, we haven't seen the agreement yet, have we? So we simply don't know. We haven't.
Touche.
Show me the agreement and then we'll know.
Isn't that pretty shocking that we haven't seen an agreement that we're signing?
Well, it hasn't been signed yet, that's
why.
But
we can't.
Well,
we're not going to.
It is the same with every single free trade agreement. It gets negotiated. You don't play a game.
We're not going to be able to see it until 4 years after we sign it, and we will not be able to change anything in it for 4 years.
With all your cards out on the
It's
table.
a ridiculous
That's a dumb way to negotiate.
Okay, and King, the TPP, what will happen to Pharmac? Nothing's going to happen to Pharmac. Pharmac are solid, are sealed, nothing's going to happen to them.
Pharmac itself is a solid organisation, but one of the things Pharmac does for us is they buy drugs on our behalf, and they are able to negotiate prices on our behalf.
And John Key said they'll be not affected, they won't be affected.
No, but if you extend the patents on drugs and you make them longer, a Pharmac will not be able to buy generic drugs which are cheaper. So there will be a cost. We will wait longer for cancer drugs. We'll wait longer for heart drugs.
But the patient won't pay that cost.
That's not the point. The patient will pay because they're the taxpayer. Who do you think the patient is?
Right.
The patient is a taxpayer. The taxpayers will pay the bill for Pharmac having to pay more for drugs.
All right. What do you think? At Backbenchers TV, do stay with us. We're back for a whole lot more. Stay with us.